Hello everyone, welcome back to our channel Indian Pharma Guide. Now I am going to explain you about the topic probiotics that's there in the M.Pharmacy Pharmaceutical Analysis Department, Pharmaceutical and Food Analysis subject. Today we will discuss about the definition, history and importance and potential health benefits of the probiotics, and in my next video we will discuss about the remaining topics in probiotics. First one, definition. So here probiotics means for life. Here the pro is a Latin word and a biotic is a Greek word. Probiotic is a live bacteria with beneficial effects on the health of the host organism. So today mostly lactic acid bacteria and bifidobacteria are used as a probiotics. In most of the cases, probiotics are produced directly by the fermentation in the foods such as yogurt or supplied through the dietary supplements. Next one, prebiotics. Don't get confused about probiotics and prebiotics. Prebiotics also used often in such cases, since prebiotics refers to the non-digestible compounds that stimulate the growth and activity of the probiotics in the gut. Prebiotics are frequently used in the functional foods and typically consist of the oligosaccharides and can be found in the milk and plant with dietary fibers. Next one is history and importance. In the start of the 20th century, probiotics provide the health benefits by increasing the balance of the microorganisms in the gut. So some researchers discovered that lactic acid bacteria could reduce the growth of the proteolytic bacteria due to the production of a low pH environment. So Russian biologists observed that the population with diets rich in the fermented milk, such as those in the Bulgaria and the Russian, tended to live longer. So that by using these findings, he suggested that lactic acid bacteria reduce the intestinal pH through the fermentation, thereby limiting the growth of the harmful proteolytic bacteria. So many studies have highlighted the advantages of the probiotics, including their ability to inhibit the pathogens, support the immune system, and help manage or prevent the chronic inflammatory and atopic diseases. So research in this area continues to grow with the potential applications expanding rapidly. So more recent studies suggest that consuming probiotic-enriched cheese daily can improve the immunity in older peoples and the adults too. Additionally, cheese has been identified as an effective delivery method for probiotics. Next one, potential health benefits of probiotics. So in this focuses on researchers on the use of the probiotics to prevent or treat the some health benefits, that is the atopic dermatitis, pediatric acute infectious diarrhea, antibiotic associated diarrhea, inflammatory bowel disease, inflammatory bowel syndrome, and hypercholesterolemia and obesity. Atopic dermatitis. Atopic dermatitis is the most common form of the eczema, is also one of the most common chronic inflammatory skin diseases, and it is mostly affected to the children 15 to 20% and adults 1 to 3% total worldwide. So some numerous studies have evaluated the effect of various species and strains of bacteria on the prevention of the atopic dermatitis, and several meta-analyses have synthesized the findings of these studies. So finally they found out the exposure to the probiotics during the pregnancy and in early infancy might reduce the risk of developing atopic dermatitis in the future child. Next one is pediatric acute infectious diarrhea. So acute diarrhea means loose or liquid stools and an increase in the frequency of the bowel movement. Acute diarrhea can be accompanied by the fever or vomiting, and it is usually lasts not more than 7 days. If we use the probiotics as the supplements, decreased the risk of the diarrhea would last 4 or more days by the 50% and led to approximately 1 less bowel movement on the second day in the patients who received the probiotics compared with the patients who does not receive the probiotics. Next one, antibiotic associated diarrhea. So antibiotics are the other common cause of the acute on-site diarrhea. So antibiotic treatment often disturbs the intestinal microbe by decreasing the microbial diversity and can lead to loss of the microbial metabolism and loss of colonization resistance and increase the intestinal mortality. So up to 30% of the patients who use the antibiotics experience the antibiotic associated diarrhea. Next one, inflammatory bowel disease. So the exact cause of the IBD is unknown, but is probably a combination of the inherited and environmental factors, including the genetic alterations and immune system dysfunction. So, after some researchers found that whether the individuals with IBD have the alterations in the gut microbes and whether the probiotics might help to manage the inflammatory bowel disease. Next one is irritable bowel syndrome. So, the causes of the IBS are not completely understood. Growing evidence suggests that the potential roles for the intestinal microbiota in its pathophysiology and the symptoms. So, IBS has also been linked to the stress. Next one is hypercholesterolemia. High levels of the cholesterol in the blood or cholesterol trapped in the arterial walls are the risk factors of the cardiovascular diseases, and low density lipoproteins carries the cholesterol to the tissues and arteries. So the higher levels of the LDL levels, the greater the risk is for the cardiovascular diseases. High density lipoproteins carries the cholesterol from the tissue to the liver and lead to its excretion. So a low levels of the HDL increases a person's risk of the cardiovascular diseases. So finally, some researchers have studied that the use of the probiotics to improve the lipid profiles. Next one is obesity. So taken some researchers that indicates that the effects of the probiotics on the body weight and the obesity might depends on the several factors, including the probiotic strain, dose and duration, as well as the certain characteristics of the users, including the age, sex and baseline and body weight. So additional research is needed to understand the potential effects of the probiotics on body fat, body weight and obesity in humans. So that's all about the definition, history and importance and potential health benefits of the probiotics. And in our next video, we will discuss about the mode of action, identification, advantages and disadvantages and applications of the probiotics. Thank you for listening. Please do subscribe our channel for more videos.